Hello, Divine Reset Women. This is Lynn Ann. I'm the founder of Divine Reset. I am so excited to be here with you. It's our inspiration series. And with Divine Reset, the purpose for it is to help women and men. Any listeners that want to jump on, we're happy to have you. The purpose for Divine Reset is mainly to help women to find peace in their lives because there's so much chaos. We're being pulled in so many directions. We are wearing so many hats, and we have a job to do, and we are suffering inside because we are not living to our potential. We are living to a label or the past, and we have so much ahead of us. And so I'm bringing guests on every week with our inspiration series to help us to just handle our everyday ups and downs, and for all the rejoicing that we can do. This is when we can get a handle on things and really just jump ahead. So today our guest is Dr. Amy Novotny. I hope I said that right.
Yes, you did. Yes.
All right. Dr. Amy is a physical therapist. She has years and years of training, obviously, because she has her doctorate. She's worked with a lot of clients, a lot of patients, and she has developed an incredible breathing system technique that has helped countless people. And she'll give you information about her website. You can go and hear testimonials. And so we have the great fortune of having Dr. Amy here to describe what it is, what this magical technique can do for you and your loved ones, and how it can empower every cell in your being, every single part of your existence. And I'm so excited that you're here. Thank you, Dr. Amy.
Thank you, Lynn Ann. I'm very honored to be a part of this, and I really appreciate you having me on today. I would love to share to all of your listeners and viewers today a technique that I developed over the past about 5 or 6 years, and it's continuing to evolve, but originally I started out looking at how can I help people out of just regular pain or even chronic pain. And I did traditional physical therapy for about 5 years before I started looking at how breathing and the way that you position your body actually affects you in a huge way. It affects you in terms of your pain level, your mobility, your flexibility, your strength. It affects your stress, your anxiety, your ability to sleep. And so originally I started practicing on my own. I took some coursework through the Postural Restoration Institute, which looks at how breathing and asymmetries in your body affect the way you move. Now, when I started looking at this, I didn't know how to implement it, and there wasn't a really good technique on breathing. So I started playing on myself first. And at the time I was running for fitness and also for mental clarity to help me de-stress. And I noticed that my running speed just got faster and faster and faster. And I was training for marathons at the time. And specifically, I was training to qualify for the Boston Marathon. And my speed just jumped. Between March and October, my marathon speed dropped by 14 to 15 minutes, which if you run marathons, that's a lot of time. And I did nothing different except change the way I was breathing and the way I held my body. And so that's what I want to share with people, because after I did this on myself, I started figuring out how do I explain this and communicate this to other people so I can help out more people. And now I actually have a practice where I work with clients one-on-one to teach them these things, to help them get out of these anxiety attacks, to help them increase mental clarity and focus, to increase that mindfulness and presence of body, and even to get people out of various orthopedic surgeries, whether it's disc herniations, rotator cuff or ACL tears, or even stuff that seems chronic like a knee replacement. When you have arthritis, that doesn't mean you have to go and get a joint replacement. We've been able to get people out of knee replacements, hip replacements, finger joint replacements, just by changing the way they breathe, how they position their body, and calming down the nervous system. So I'm going to go into just a little bit of the details of that, and then actually go into the technique so that all of you guys have something to practice at home to get you started on this new journey and new path to help you reset your life, which we all know that we need help, and sometimes having a nice community like this one, you get ideas to help you change your life for the better. So
Oh,
what I
awesome.
want to talk about, okay, sorry. So what I want to talk about first is we're going to go over your posture and body position. So I'm going to demonstrate a little bit. Now, when we're taught good posture, we're taught chest back, shoulders or chest out, shoulders back, suck up your gut. So we're taught to be in this really upright posture, and we're taught that because we want to exude power, prestige. But unfortunately, that's not exactly the best thing. I've studied a lot of anatomy and physiology over the years, and here's what I want to share with you. So if you think of your rib cage as a cylinder that goes in your body here, if my fingers right here are the front of the ribs and my thumbs are the back, if you take a rib cage that's supposed to be this cylinder and you lift up the front so that your chest is out and shoulders are back, the back part, which are my thumbs, go down and you start to hinge off your low back. So if I'm sitting here kind of in neutral and I lift like that, you can see this curvature in my back kicks in. What happens is these muscles in my low back start to tighten up, and that becomes my new normal. Tight muscles that pinch on my discs, nerves, and vertebrae in my low back. The problem is, you can see also, in order for me to do that, my pelvis tips forward. As soon as my pelvis tips forward, that decreases space to my hip joints. And if I'm standing, now all of a sudden my body weight shifts forward. So pressure goes differently in my knees and in my feet. And the same thing that happens in my upper body. As soon as I go like this, I change and decrease the space available in my shoulder joint, and my head typically juts forward just to balance my body out. But if I can come back into neutral, I'm in a better position. Now, the reason why this is important is learning how to be in neutral helps us to calm down. So we have a nervous system in our body called our autonomic nervous system. There's actually three parts to this system. There's the enteric part, which deals with your gut and how well you digest. But there's also the sympathetic nervous system, which is your fight or flight system, and then your parasympathetic, which is your relaxation. Those are the two I want to focus on. So if you think about all the stresses that you have in your daily life, work, finances, relationships, kids, driving, any physical stresses, emotional stresses, mental stresses, all of those kick us into fight or flight mode. That sympathetic nervous system kicks in. When that happens, our muscles are taught to tighten up throughout our body. We feel it as tension in our body. Now, that's good when we need to fight or flee something, but when it happens all day long, every day, we adjust to that. We lose the ability to relax and to be in parasympathetic relaxation. So we lose the ability to digest well, to rest, to sleep well. All these things that we need and we should be in most of the day, we lose the ability to do that. And the most important part is we lose this sensation of how to relax our body. So I see a lot of people whose shoulders are up or like this, or just even tight. And I'll tell them, relax, try to let go. And they say they are, because they don't know how to truly let go. So one thing I'll ask people is, so your breastbone here, I also see sternum. Can you move your sternum? Can you take it from prominent and drop it in without going like this and punching over? And if you can't do that, you know you have some underlying muscles that have learned to fence and guard you up. And that becomes a problem over
Dr.
time.
Amy, you're kind of getting a little muffled. Maybe can you come back a little closer?
Okay. Sure, definitely. Can you hear me any better now?
Yeah, that's better. I don't know why.
Okay. So when we have this sternum here, we need to be able to move it and to relax it. So why are we doing this? Well, we want our bodies to be calm most of the time, and then when we need to fight or flight or act or perform, we need it to kick in. If we're constantly at a high level and that becomes our baseline, then when we need to go and act, we don't have any reserves to do that, or our reserves are very small, and so you're not going to be able to perform well. I see that a lot of people who get this adrenal fatigue where they push, and all of a sudden everything in their body fails. And then they end up with stuff like fibromyalgia, chronic fatigue syndrome, and even other conditions that deal with the thyroid or adrenal glands. And they just have this whole crash of every body system. It's because we don't, one of the reasons is because we don't allow ourselves to get back down into relaxation mode. So one of the strategies I use with people to help them with that is how to change your breathing. So breathing is very important. And here's why. If you think about your diaphragm inside you, so we hear diaphragmatic breathing, and we often think, okay, belly button. So our diaphragm is a dome. When that dome contracts down, that creates negative space when you're inhaling for air to flow in to your lungs. When you exhale, the dome goes back up. In order for this process to work, you need a strong base of support, which is the walls of the diaphragm. We want this to be good and strong because it stimulates a nerve that calms our body down into parasympathetic relaxation. The thing that gives us the support for the diaphragm are your side abdominal muscles. So if your side abdominal muscles don't know how to work and support your diaphragm, your breathing will look, you lift up your ribs, you push out your belly because you don't know how to use your diaphragm well because your side abdominal muscles are not supporting it. So what I tell people is we have to change the way you breathe to help you get the side abdominal muscles to work. So I'm going to show you a little bit first. So I want you to think about the nervous system that we were just talking about that puts us into fight or flight mode. It's in our back. If we're constantly in this posture like this, we're crunching on that nervous system. And so when we're like this, when we breathe, we have to lift up our shoulders, our ribs. And so when we do that, our ribs are flared out and our side abs are not pulling them down back in. That becomes a problem. So instead, we want the ribs, instead of being flared out and you could feel like a drop off on yourself, we want them to be down and our breastbone, our sternum to be down and in. And I tell people, let your belly out. Let that gut stick out because this is your gatekeeper. If this is sucked in, guess what? Your ribs go up. If you let your belly button out, then all of a sudden your ribs can drop down. Your side abs can then pull the ribs down, one, to support the diaphragm, but two, to get your rib cage out of that hinge off of your low back. It's one reason we see so much low back pain is because we're hinging off of that low back all the time, which, as I mentioned earlier, it affects the rest of your body and you can get pains that show up anywhere. But what we do is we get the ribs back into neutral. We learn how to breathe differently. The muscles start releasing in our body. And when they release, the bones release, the joints go back into the normal position. This is how you can get people out of a whole variety of orthopedic surgeries. You can get rid of that tension and pressure in your chest because mobility here, there's movement. And so all of this is very helpful for a whole wide variety of conditions. I use this at night to sleep. I'll practice now I'm at the point where I practice a minute and I am out. I mean, I even had this checked. My latency time for falling asleep is less than 2 minutes because I can go through the breathing and I just sleep and I'm way out. So you can use this to calm yourself down and to feel your whole muscles in your body just let go. So what I want to do now is just go through the basics to get you started on it. I have more videos on my website, paberinstitute.com, and I'll tell you that again in a second. But I want to get you going with the basics. So what I'd like you to do is sit in a chair with a back to it. So I'm not going to do one with the back to it just so I can move and you guys can see me, but I would really like you to have a back to your chair. Sit all the way back, let your low back sit all the way back to the chair, your butt all the way to the chair back. Put your knees close together as you can, feet flat on the ground. We always want to be grounded on our heels. First thing then will be letting our belly hang out. Now we're going to go through a 4-step breathing process and just to get into a rhythm, okay? Once we do that, I'll explain a little bit more. So the first step will be breathe in through the nose, pause a second, blow out through the mouth, and then pause 3 seconds. And then during that 3-second pause, you're holding your breath. So we're gonna breathe in. Okay. So what we're doing is we're breathing in through our nose, and when we breathe in, we're not trying to lift up our chest, we're not trying to push out our belly. We're thinking breathe in our nose, almost like we're filling in our throat. Then we're gonna pause a second and then blow out through the mouth as if you have an open airway, and everything just can come out with no pressure in your chest. No hard pressure, no pursing of the lips, no huffing out, just a nice blowing out. And then we pause and hold our breath for 3 seconds to allow our diaphragm to relax back up into that cone shape, so that way it can descend again when you inhale. So, and you saw I put one hand on my chest, or I'm gonna put the other hand on my belly. So as I blow out, my chest goes in, my belly comes out. It spills out, so it gives my ribs a chance to go down towards my hips. So I'm gonna breathe in through my nose, pause, and and if you look closely, you can see that my chest is going in, but I'm not throwing my shoulders forward, and my belly is coming out. Now, it's hard to do this initially. I don't expect anyone to get that perfect initially, because it is very, very difficult. So this is something to practice and get started, and I'd love to hear from you if you have questions about it. You can send an email to me, Amy, A-M-Y, at PABR-Institute.com, and PABR is P-A-B-R Institute.com. And so what you want to feel is you want to get a sense of your sternum letting go inside, your ribs letting go and relaxing, your belly button coming out, and your whole ribs dropping down. As you start to practice this, and as you feel this, as you're exhaling, you'll feel your body start to let go all over. And when you go to move again, you'll feel this freedom of movement, this lack of pressure. People have described it as like all the stress goes out of their body. But I've used this in so many different sports, for lifting activities, for people, young kids who have ADHD with problems focusing, all the way into the elderly in their 70s and 80s who are having trouble with mobility. It can really change your life. Just practice about 5 minutes, a couple times a day, sitting and lying down, and it will just change your whole world. So, I have more information on my website, PABR-Institute.com. It's P-A-B-R Institute.com, and that stands for Pain Awareness Breathing Relief. Thanks.
Wow. Oh my goodness. Thank you so much. It is a real different way of thinking about posture. I mean, I know posture is, I look at it as, gee, that's not attractive. If I see the hunched shoulders, or, you can't really see me. But but you're saying that it is really the way we carry ourselves, sitting, standing, probably even sleeping, that
yes,
we are we're keeping ourselves in that stress state.
Absolutely. Absolutely. The way you position your body affects the way you breathe and affects your nervous system. And both of those affect the way you hold yourself. Literally, I've been getting more kids with ADHD and on different levels of focus. And I see all of them with their chest out, and they're walking on their tiptoes. They can't calm down. Their nervous system does not allow them to calm down, because it's constantly being crushed in their back. Same thing with human, adults too. The ones that I see, anyone who I see that's a high achieving or just really ramped up, they walk and their back is at the hinge, and they're walking using their back, and they cannot calm down because the way they position their body does not allow them to. It's
Wow.
that critical. Yeah.
Oh my goodness. So do you, if people are not in your state, because you're in Arizona,
Mhm.
if they're not in
Yeah.
your state, then can they work with you long distance? How you, okay.
Yeah. Yeah, so I do virtual sessions. I have people actually all over the world. We do virtual sessions through Zoom or Skype or FaceTime, WhatsApp. So we can do sessions that way. Some people in the States have actually do fly in and do a 2-day intensive where they want to learn a lot in a short period of time and have a full program just to go home and practice. And so we'll do that, about 4 to 6 hours over the course of 2 days. We split it up so they have time to practice in between each session. So either way is available. And really, I am here to help. Any way that I can serve someone to help them get better and change their life, I am willing to accommodate them.
Oh, that is so, so wonderful. Thank you. I'm very enlightened by this time with you. I knew I would be excited. I was already excited going into it. And now you're speaking to me. I have had the adrenal fatigue, and I have an autoimmune disease now, and I want to reverse it. And I think the first thing I have to do is really do a posture check, and I really have to calm down, and I've got to apply these things. So I'm going to definitely be
Yeah.
rewatching this over and over,
Good. Good.
and refer to your website too, because I'm sure you have more things. You probably have diagrams and other things like that.
I have different interviews and videos, so there are plenty of resources on there. And then I have individual programs for people, so I give them actually sheets and stuff when we work one-on-one, so
Okay.
that way I can help someone address their specific needs. But first and foremost, change your posture, let your belly out. Like, let your belly out, let your sternum go in. If I can't say that enough to people, is please let go. The faster you do that and get out of that perfect posture and what we've been taught, the quicker you're going to change your life. And blow out and let your belly out. I just have to say that.
Amen. Amen. Thank you so much. And so our listeners, Dr. Amy Novotny, she can be reached at Amy at pabrinstitute.com, and reach out to her. She is a great resource. So thank you so much.
Thank you again for having me on your show. I really welcome that opportunity and I'm honored to be here. Thanks.
Thank you. Bye-bye, everybody.